Every day, people from around the world will look at themselves in the mirror. How we look is an important part of our society. But how do we look at ourselves? Is it important to look our best at all times? Often in the media, looking bad can be seen as a bad thing.
Mom, Dad, am I ugly?
Oh, of course not, sweetie.
Yeah, where'd you get a stupid idea like that?
Craig Hoffman.
Craig Hoffman said that? Well, he's a sharp kid. You might be ugly.
There's my favorite Duff.
Sorry, what?
Duff. D-U-F-F. Designated ugly fat friend.
What did you just say to me?
What do you think?
That looks so sexy.
Are you kidding? Hi, I'm Cellulite Sally. Look at my huge badonkey. Oh, and don't forget about me. I'm back fat Betty. Now, who could have said that? Oh yeah, it's Tina the talking tummy. I can't even wear a short skirt and a top without looking like a fat bitch.
Even though it's portrayed as funny, when does the joke become something more serious? When do people start to get hurt? I spoke to psychologist Jonathan Firth to find out more.
So body dysmorphic disorder is part of a group together with obsessive compulsive disorder and some other obsessive type disorders. It's very similar to obsessive compulsive disorder in that the person has an obsession, but with body dysmorphic disorder the obsession is with some aspect of their appearance. The person maybe felt that their skin colour wasn't very pleasant, even though maybe that was invisible to everybody else. They may do something in terms of makeup or even some kind of professional skin treatment to try and deal with that. It's very hard sometimes to say exactly how disorders come about, but as with any anxiety type disorder, it's probably a combination of the person's personality and life experiences. So they may have been teased about something as a child, and the thoughts that they have about this particular issue have perhaps increased in strength due to life experiences. Disorders than others. Overall, about 2% of the population have body dysmorphic disorder. So it is a relatively prevalent disorder, but most people don't develop these kind of extreme obsessions. It's sometimes hard to draw a line. Most of us do have some kind of hang-ups about our appearance. Where does it become a disorder? But you're looking at very extreme levels of thoughts and behaviours about the appearance with BDD. The key symptoms would be that the person has thoughts about their appearance that are out of touch with reality to some extent, in that the person's appearance is not actually problematic. The things that they're obsessing about may be invisible to other people, or they may be perceived by other people as being very slight. But it would have to be something that is somebody spending a lot of time on. So for example, if somebody's spending an hour or more per day trying to do things with their appearance to cover up a perceived flaw that's invisible to everybody else, then that would be considered in the diagnostic range for BDD. So it would have to have some impact on the person's life. Probably in terms of feelings, they would be having high levels of anxiety, worry, and it may well affect things like their willingness to go to social events. Perhaps they would not be willing to go for a job interview because they would think, everyone would judge me for my appearance, when in fact that's not really true. Well, I mean, it can affect anyone, any group in society. What you will find though is a slightly increased prevalence among adolescents, because at that time your body is changing anyway. And I think people do, at the same age, eating disorders tend to become a major problem. At that time people are exposed to perhaps more peer pressure about their appearance. So there's an increased risk at that time. But the obsessions and worries that people develop in adolescence may then continue quite a long time afterwards in some individuals. I mean, it does affect both males and females. You might see an overlap with, particularly with female patients, of having eating disorders. With males, there might be overlaps more in other areas. There might be, in some cases, for example, there might be an obsession with perceived lack of musculature, and that they feel that they're perhaps sort of too skinny or too weedy. So it will perhaps differ slightly between males and females, but it does occur in both.
So what do some people do to fix their problem?
In some cases, surgery is estimated around 10% of people who go for cosmetic surgery clinically have BDD.
Botox. My first procedure was my breast augmentation right when I graduated high school.
I started getting facials and face peels in high school. Started with Botox at my early 20s. I got my breasts done this year, actually.
Plastic surgery is becoming more and more popular in the UK. I spoke to Dr. Ken Stewart, a practicing plastic surgeon.
UK was breast augmentation, liposuction, rhinoplasty, prominent ears, abdominoplasty, breast reduction. A lot of women, for example, who have had children, they have loose tummies after their children, they simply want to kind of rectify that and have a tighter tummy again. Or people that have born with larger noses or prominent ears or small breasts, they want to rectify what they've perceived as a kind of anomaly. About 10% of cosmetic surgery is for men. It's slightly increasing over the last 5 to 10 years. And typically the most common things I would do in men are prominent ear correction, rhinoplasty, and man boobs or gynecomastia. Deal with babies right up to geriatrics. Well, you could argue that some of the things we do in babies, like removing little skin tags in front of the ears, has no functional significance. It's done purely for restorative purposes because they've got an anomaly. You could argue that a cleft lip operation is a cosmetic operation. For example, prominent ears, we regularly do prominent ear corrections in children as young as 8, because they've been teased by their friends at school because they've got very prominent ears that they want rectified. Equally, I've done prominent ear corrections in 70-year-olds that have retired and are fed up with having these prominent ears all their life. People come to see me because they perceive they've got a physical problem or a physical anomaly or difference that they want corrected. They don't often perceive it to be a psychological issue. Clearly often there's an overlap. Clearly often not everyone that comes to see us requesting cosmetic surgery do we accept for cosmetic surgery, because sometimes their issues are predominantly psychological. I think for the patients I operate on them because I think it's the right solution for them. And I've no reason to think it's people's right to choose what they do with their own bodies, by and large. So we're very conscious that sometimes people have psychological issues, and for some patients with psychological issues, cosmetic surgery is clearly contraindicated. Yeah, I mean, I've had I've had surgery on my nose for nasal obstruction, which is a kind of lifestyle surgery that I had because I couldn't breathe properly through my nose, and there's not much difference between that and having a nose to reduce the size of the nose. A lot of surgery that's done in the UK is lifestyle surgery. For example, people have shoulder stabilisation so they can keep playing tennis into their 60s. There's no difference between that and cosmetic surgery, really. Yeah, we are very conscious of body dysmorphic disorder and the kind of risks of that. Body dysmorphic disorder is not a black or white issue, it's a kind of a grey-scale spectrum disorder, and everyone has a bit of sensitivity about their appearance.
One group of people in particular are associated with body image. Bodybuilders. Bodybuilding is one of the fastest growing sports in the world. It involves trying to become as muscular and aesthetically pleasing as possible. I spoke to Colin Sanchez, a competing bodybuilder, to find out what it takes to become a bodybuilder.
Okay, for me, bodybuilding is an extension of me working out and training in the gym. I always used to take sport seriously. It used to be football for me, and then when I got a little bit older, I lost interest. I wanted to do something new, and that was the gym. And from then on, year on year, I took it a little bit more seriously, and eventually I decided I was going to get into bodybuilding because that was like as far as I could take things with regards to training in the gym. It was something fresh, something different that not a lot of people were interested in, and not a lot of people that stayed consistent to it. When I kind of started getting into things, I was about 16 when I got my first membership, and didn't really know what I was doing. I was a bit of an amateur, and I noticed there was a guy who was now my coach for the first competition. His name was Joe Parrish, including myself, and a lot of other people my age saw him as a bit of an idol. He competed in his first bodybuilding competition last year, and he's since encouraged a few more of us to get involved. For me, not so much, Arnold Schwarzenegger obviously hugely respected within the fitness industry, but more my time there's people like Steve Cook, Jason Poston. They're probably my two favourite athletes. Probably Jeremy Bundia, who won the Men's Physique Olympia last year as well. He's came on to things. They're probably my favourite three athletes, but obviously there's people much bigger like Arnie, Phil Heath, and Kai Green as well. So there's so many, and there's so many people that you can take inspiration from. I idolise them because they're different from everybody else. They live a great lifestyle, a fantastic lifestyle in my eyes. I like the idea of getting up, training every day, travelling around the world, representing your supplement companies, your sponsors, competing in different competitions, travelling the world. They've got a fantastic lifestyle, and they love what they do. They train every day, they get to compete in brilliant competitions, and I think that's my dream. The thing is with bodybuilding that you're never really happy. You don't have a set goal every week. You go to the gym and you think, how can I better myself from last week? And that rolls on every week. So tonight I'll go into training and I'll see what did I do last week. Can I move up? Can I increase? Can I make a better session than last week? And it's always spiraling on. You're never happy. You're never satisfied, and you're always looking for new results. And there is no end goal. That's the great thing about it. I do, in a sense, yeah. I can see why people see it like that, but what they don't see is the hours of training that go in. They don't see the sacrifices. They don't see people that haven't drank in months, haven't drank alcohol, they haven't gone into nightclubs, they have had early nights where they could have gone out with their friends and stayed out till 2 in the morning. They've had a quiet night because they're going to be training at 7 the next day. They don't see all the sacrifices, and they don't know how it feels. And okay, it looks like vanity, and they look like they want to show their body off all the time, but if you work hard for something, you're not going to hide it, you're not going to conceal it. So in a way it's well earned, and you also you physically feel better as well as looking better aesthetically. So there's more than just the looks.
From all this, I've learned that you should be happy with the way you look, because no one else looks like you.
I know that I have made mistakes, but I'm better for that now.
Okay, one last thing. I'm doing a men's physique competition, the UK BFF Scottish Championships in Paisley at the Lagoon Centre. The date is Sunday the 24th of May. Get along and support me.
Throw me some